millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hello, everyone, and welcome back to the Diverse Thinking, Different Learning podcast. I'm your host, Dr. Karen Wilson. I am recording this episode in June 2023, the beginning of summer, and I thought it was a good time to do a summer mental health check-in. In 2021, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association declared a national state of emergency in child and adolescent mental health. And that was because of soaring rates of depression, anxiety, trauma, and loneliness in American children and youth. And last year, health organizations were actually asking officials to declare a federal national emergency in children's mental health. And this is not just an issue in the United States. Many Canadian teens are still struggling with their mental health, and pediatric centers are reporting increases in hospitalizations and emergency room visits for eating disorders, anxiety, and suicide attempts. Early this year, the Canadian Mental Health Association sounded the alarm on kids' mental health, stating that children can't access the care they need when they need it. Well, here's what we know. Over 20% of children have some type of diagnosable mental health problem in the first 18 years of their lives, and most never receive services. Even before the pandemic, childhood mental health challenges increased substantially in the U.S. Results from a national survey of children's health in 2018 revealed a 73% increase in the rate of depression and a 95% increase in anxiety in young people. And children with learning challenges are at greater risk for mental health struggles. I'm hearing so many parents that say they don't feel that they have the tools they need to support their kids, particularly with regards to their mental health. And at the same time, studies show that 75% of kids say that when they struggle, they want and need their parents' support. Well, here at Child Nexus, we want to ensure that parents get the support they need to meet their children's needs. So for this episode, I'm going to discuss 10 ways parents can support their children's mental health during the summer months. So here are just a few strategies to consider. Number 1, maintain a routine. Establishing a consistent daily routine can provide structure and stability for children. And this is particularly important for children with learning differences as they thrive with clear expectations and predictability. And so now is not the time to throw out the routine because summer is here. Stick to those bedtime routines. It's really important. Number 2, encourage physical activity. You want to engage your child in regular physical activities. Exercise has been shown to have positive effects on mental health by reducing stress and anxiety. So what we want to do is encourage activities that children enjoy and that are suitable and consistent with their interests. Number 3, explore interests and hobbies. Summer is a great time to help your child discover and engage in activities that they enjoy and are passionate about. It's important to encourage their interests, and that can boost self-esteem and provide a sense of accomplishment. Number 4, foster social connections. Summer is another great time to facilitate opportunities for your child to connect with peers, family members, and other groups who share similar interests. Social interaction is crucial for mental well-being. So you want to encourage playdates, community events, and even online groups that align with your child's interests. We know that social connection significantly improves the health and well-being of all individuals. And research shows that being more socially connected can improve stress responses and minimize the negative health effects of stress. Also, children and adolescents who enjoy positive relationships with their peers, parents, and teachers experience improved academic outcomes. So we want to make sure we use those summer months to facilitate social connections. Number 5, maintain learning. Summer break doesn't mean that learning stops. Keep your child engaged in educational activities. Obviously, we don't want to overdo it, but look for resources, summer camps, or programs that support them in areas of weakness and build up those weak skills. This can help prevent learning regression and promote continued growth. At the same time, it's important to have balance. It can't be all about educational activities. We want to have balance between educational activities as well as leisure activities. Number 6, open communication. Create an environment where your child feels comfortable discussing their feelings, concerns, and experiences. Encourage open dialogue. Engage in active listening and validate their emotions, their feelings. Let them know that you're there to support them unconditionally. Number 7, celebrate progress. This is a great time to recognize and celebrate your child's achievements, both big and small. You want to acknowledge their efforts, their growth, their perseverance. And this positive reinforcement can boost their self-esteem and their motivation. Number 8, promote independence. Encourage your child to develop independence and self-advocacy skills. Summer is a great time to teach and model problem-solving strategies, decision-making, and self-regulation techniques. Gradually empowering young people can enhance their self-confidence and resilience. Number 9, and this is for parents, practice self-care. Taking care of your own mental health is equally important. Parents need to prioritize self-care activities that rejuvenate you and help you to manage stress. When parents are mentally and emotionally well, they can better support their children. And finally, number 10, seek professional support if you need it. Consult with professionals, therapists, counselors, or educational therapists and educational specialists who can provide guidance tailored to your child's needs. If they're struggling emotionally with anxiety, depression, make sure that you connect with professionals who can offer strategies, resources, and direct support to address specific challenges and promote overall well-being. Remember, every child is unique, and what works for one may not work for another. So be sure to adapt these strategies to suit your child's individual needs and interests, and regularly reassess and modify your approach if needed. Let me know if this information was helpful. I want to hear from you. You can DM me on Instagram at Child Nexus Community or shoot me an email at drkiwilson@childnexus.com. Thanks again for listening. Happy summer.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.